Well, good morning, and thank you for joining us for today's press conference. If you need access to record or would like to ask a question, please indicate so in the chat. We have 30 minutes for the press conference today and a limited time for questions, so please only ask one question. If there are remaining questions in the queue when we conclude and you feel your question hasn't already been answered, please submit your questions in the chat or by email, and we'll work to get you a response in writing. We will begin in just a few moments after we grant recording permissions.
Hey, how you doing? All right.
Yeah, I gotta order it.
Yeah, thank you. Okay, I believe all permissions for recording have been granted. If you requested permissions in the chat, you should now be able to record. If you still need permissions granted, please leave us another message in the chat. Dr. Vanderhoff, we'll hand it over to you now to begin today's press conference.
Well, good morning, and thank you for joining us today. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. It may seem hard to believe, but we're rapidly approaching back to school time. And as we think about the new school year, it's a very good time to consider our children's vaccinations and the impact they have on preventing illness. Despite the volumes of data that assure us that vaccines are safe and effective, too many of our children continue to suffer from some very serious vaccine-preventable childhood illnesses that some might mistakenly think are just a part of the past. In Ohio, required school immunizations help protect our students from 10 preventable diseases: diphtheria, tetanus, pertussis, which is also known as whooping cough, polio, measles, mumps, rubella, also known as German measles, hepatitis B, varicella, which you may know as chickenpox, and meningitis. In the 2020 to 2021, as well as the 2021 to 2022 school years, the percentage of Ohio's children entering kindergarten who had all the required school immunizations actually declined. Now, some of this was likely due to the impact of COVID-19. Many people nationally missed routine well visits during the early days of the pandemic, and many schools were conducting remote learning, perhaps lessening the opportunity as well as the sense of urgency for parents to get their kids vaccinated. Nevertheless, I'm pleased to say that Ohio's kindergarten vaccination rates actually improved in the last school year, 2022 to 2023. Which I am hoping is the beginning of an upward trend. However, the fact remains that nearly 10% of all Ohio's kindergartners, that's more than 12,000 children, were missing at least one required dose or had no immunization record on file during the past school year. Now, this puts too many kids at risk for developing serious illnesses that plagued earlier generations, but thanks to routine childhood vaccinations, are now rarely even heard of. One example of the unfortunate return of a serious vaccine preventable childhood illness occurred last year in New York, when a case of polio was diagnosed in an unvaccinated adult. Our parents and grandparents lived through a time of great fear of polio, a time in which this infectious disease caused paralysis in many children and was a truly frightful thing. Now, much closer to home, we suffered through a measles outbreak here in Ohio late last year. The outbreak affected 85 children, all unvaccinated. People forget how serious an illness measles is, underlined by the fact that about 40% of the children in our Ohio outbreak had to be hospitalized. Fortunately, no child died. But this is a bad illness, particularly for very young children, and it can lead to very serious complications. Polio and measles, though, are not the only threats. Getting a tetanus shot is so important to ensure against developing lockjaw, a severe and very painful illness. Whooping cough can be very serious for our youngest children. All of us who are about to have a newborn in our family or in our extended family should really make sure that the expectant mother and any adult who may have regular contact with the baby is up to date on the TDAP immunization. Now, if you don't have health insurance, or if your insurance doesn't cover vaccines, the Ohio Department of Health works to supply vaccines free of cost to providers enrolled in the Vaccines for Children program. It's a federally funded program that provides vaccines at no cost to children who might not otherwise be able to get vaccinated. To learn more about the program, please contact your local health department or the Ohio Department of Health's immunization program. Now, I mentioned earlier that about 10% of Ohio kindergartners are not fully immunized. We respect that people have questions about childhood vaccines, and we encourage people to talk with their provider about the risks and benefits of vaccinations so they're able to make a well-informed decision for their child's best health. But the science is very clear on the safety and effectiveness of vaccines. For example, the 2-dose MMR vaccine that protects against measles, mumps, and rubella has been proven to be 97% effective. Now, along those lines, I want to address a 25-year-old study that linked vaccines to autism. This study has not only been rebutted by numerous subsequent studies, a list of those, by the way, can be found on the Centers for Disease Control and Prevention website, but it also was retracted 13 years ago by the very same publication in which it was originally published, The Lancet, a British medical journal. That retraction cited an investigation by Britain's General Medical Council that found that the authors had acted unethically and had shown callous disregard for the children involved in their study. The fact is that vaccines substantially reduce your risk of developing numerous serious illnesses and are very practical and very important health interventions that we all can trust. And those of us in public health will continue to do as much as we can to educate Ohioans on the science and the importance of vaccines. Happily, science continues to develop new weapons against diseases. RSV is a serious respiratory virus that flared up in near record numbers last fall here in Ohio, and which nationally is the leading cause of hospitalization in infants under 1 year of age. The U.S. Food and Drug Administration, the FDA, on Monday approved a shot to protect newborns against RSV. The shot is a monoclonal antibody which provides passive immunity, much like the passive immunity a baby might get through a mother's breast milk. The RSV shot is given as a single injection to an infant before RSV season, which usually peaks in the fall and winter months. The FDA approval also allows a second injection for infants up to 24 months of age who remain vulnerable through their second RSV season. Now, we await action from the CDC's Advisory Committee on Immunization Practices, the ACIP, which is expected to formalize recommendations and provide clinical guidance for providers at its next meeting coming up in August. Now, earlier this year, the FDA and the CDC approved an RSV vaccine for older adults, those at least 60 years of age. The CDC recommends that you discuss this option with your provider if you're over 60. Lastly, though thankfully the number of Ohioans who have contracted severe cases of COVID-19 has continued to decline in 2023, we can't forget the importance of making sure that you're up to date with your COVID vaccines, particularly with fall and winter just around the corner. For anyone who is 65 or older, or anyone who's immunocompromised or has a serious underlying health condition, if you have not received a bivalent booster, I would strongly encourage you to get one. And of course, I'd encourage anyone of any age who's not had at least one bivalent vaccine dose to consider getting one to ensure that you have the best protection against severe illness. With all these vaccine-preventable infectious diseases, having a community with high protection levels makes it hard for these dangerous diseases to take hold and to spread effectively. So we're all in this together. And the good news is that we have the tools to protect each other and to protect ourselves. So let's get our kids vaccinated and keep their vaccinations up to date as they head back to school. And now I'd like to turn to our two guests today, Dr. Douglas Harley, the president of the Ohio Academy of Family Physicians, and Dr. Sarah Bodie, a primary care pediatrician and the medical director of Nationwide Children's Hospital's school-based health services. And they're here to help us discuss vaccinations and other important topics relating to the health of our children. So first, let me turn to Dr. Harley. Dr. Harley, I've been emphasizing the importance of childhood immunizations. In your experience and in your practice over the years, what messages have you given parents about vaccines, and has there been any change in how you've delivered that message?
Thank you, Bruce. So, a lot of the message that I've been giving is very similar to what you had already talked about, as I think is talking about the risks and the benefits with the parents, and really talking about the diseases that unfortunately a lot of them haven't seen in years, like you had mentioned, like measles or polio, but though they're still present. I think one of the things that has changed recently, is particularly around COVID, is vaccine hesitancy has risen a little bit more than what it used to be. But I think really a lot of it is still continuing to have those conversations with the parents, with the patients, particularly if we're talking adolescents, and really talking about the benefit. I think once you kind of find that and figure out what their worries are, a lot of times you can work around those pieces and talk about sometimes it's misinformation or where they got the information, and really trying to help work with them. But I think, it all comes back to the relationship that you've built over the years with patients, that trust with that. I'm the president of the Ohio Academy of Family Physicians. We represent about 6,000 family physicians throughout the state of Ohio. And I think that's been one of our big things that we encourage. And I'm also a residency program director, is we encourage developing those relationships with patients, because that's how you build that trust. I mean, you can liken it back to things like hypertension. Patients don't want to take hypertension medications because, well, it doesn't make them feel any different. But the the longer game, there's a lot of risks with uncontrolled hypertension. Same thing comes down to vaccines. If you're not getting vaccinated, down the road, something is going to get you. I talked about measles. I always tell patients, your risk of death with measles, even though people haven't seen it for years, is still about 1 in 1,000. And, Powerball is big right now. I don't think anybody won last night. Your risk of dying from measles is way higher than your potential risk of Powerball. But everybody always thinks, well, I'm going to be the one that wins the Powerball, and you run out and buy your ticket. So I think, we have to play the odds, and the odds are definitely in our favor for vaccines.
Thank you so much, Dr. Harley. Dr. Bodie, there are many other factors that contribute to our children's health that, of course, we need to think about as our kids are heading back to school. Can you talk a little bit about the importance of things like smoking and vaping cessation, and how parents and health providers can help address that increasingly important topic in our schools?
Yeah, thank you so much, Bruce. To start, as a school health physician, I really emphasize and with families this link, of course, to start off between your health and attendance in school, and how both of those are affecting each other, right? You cannot go to school every day and be successful if you're not healthy. And as pediatricians and family physicians, as we're working with you to have your child be the healthiest they can be, we know that their education is critical to that we need them to be attending school and meeting their academic potential as well. So we really emphasize this healthy start to school. We know that kids that miss even just 2 to 4 days that first month of school, they're actually half of them are likely to miss a total of a month of school through that school year. So that early start and coming on the first day, every day, that first month of school, right from the beginning, is just critical. So when we see kids for back to school and getting them ready for that health, as you mentioned, immunizations are critically important to that, to make sure they're up to date, but there's so much more that we do within a well child check, as an example, or a back to school visit. And a lot of that has to do with talking about their entire health, right? Physical health, mental health. And then part of it is around difficult topics like those things that your kids are at risk for, like vaping. So many parents already know this, but vaping is on the rise in kids. It's an issue we take very seriously and discuss at each and every visit with our teens and with our families. We know that about 1 in 4 high schoolers, about 1 in 10 middle schoolers have actually already used e-cigarettes, typically those flavored tobacco products. So your teen, if you're listening right now, your teen already knows someone who has used this. They've seen it, it's around. And so this is a topic we really need to address. And how physicians can help is it really just opens up this safe space within this checkup where we can start to talk about these topics together. So we can be talking to the teen, talking to the parents, bringing this conversation out in the open, and really helping parents to think of how to broach the topic, how to start that conversation with their children, and really give them good information and resources about what are the bad effects of vaping. What does this do to your teen? How do you start that conversation? How do you talk with them around what their friends are doing or what they've done? And it really can be a great opportunity to start to help support these kids and families through a difficult thing. Kids are exposed to a lot these days, and we have to have conversations.
Thank you so much, Dr. Bodie. Well, as I wrap up today, I'd like to briefly mention some other topics that I think we should all be thinking about when it comes to back to school safety and the health of our school-aged children. One very basic consideration is making sure your children have a safe route to school. Parents should practice the walk or the bike ride to school, or going to the bus stop before that first day of school. If your child is biking, make sure they have a protective and well-fitting bike helmet, as well as some reflective material on their coat. Also, be prepared to submit health-related documents that schools typically collect at the beginning of each school year. These would be things such as prescription medication authorization, emergency medical authorization forms, and information on any new chronic illnesses or allergies that your child may have developed. Many schools will conduct vision and hearing screenings of the students as the school year begins. And learning can be greatly impacted if a student is not seeing or hearing as well as they could. So parents should promptly consult their child's provider if these screenings uncover an issue. Finally, it's very important to pay close attention to our children's mental health. The pandemic has brought this issue to the forefront nationally. And here in Ohio, Governor Mike DeWine has made addressing the mental health of our state a central pillar of his administration. Mental health can be affected by changes and transitions that we may think of as routine, but are nevertheless very impactful. And the school year is one of those times of transition. The crisis line 988 is an important resource if parents see any cause for concern. And consulting your medical provider or school personnel is also another good resource. Let's do all we can to look after the health and well-being of our children as we are planning for a new school year to begin. So thank you. And Ken, I think we can open it up to the media for questions.
Okay, thank you, Dr. Vanderhoff. A quick reminder to please only ask one question. And our first question today is from Joe Ingles, Ohio Public Radio and TV State House News Bureau.
Hi, thank you for doing this. My question is, through the pandemic, a lot of people were afraid of vaccines or made afraid of vaccines who weren't before. Do you see any signs that that mentality still exists out there? And what were the rates of vaccination before the pandemic versus now? Are we seeing a huge drop off from before the pandemic?
Yeah, that's a very, very good question. And let me begin just briefly commenting on the data. So as I shared during my opening comments, if we look to the 2 school years that were right in the midst of the pandemic, both here in Ohio and nationally, we did see somewhat of a downturn in our overall vaccination rates. However, there's a little glimmer of hope in that as we looked at the last school year, the one we just came out of, we actually saw those rates bump back up a little bit. And as we look at the overall rate of vaccination, Ohio is doing pretty well. We look at the kindergarten rates of vaccination, and while during the pandemic, we dropped a little bit below that 90% threshold, we got back around that 98% threshold last year. And obviously, we would like to see those numbers be even higher. Ideally, it would be a good thing if we could see vaccination rates here in Ohio approaching the high 90 percentile. There's always going to be some portion of our population for whom vaccination is not the best option due to medical conditions or other underlying concerns. But, for the vast majority of us, it's clearly the right way to go. So we're very eager to see some of that gap close. Now, in terms of, well, why would people be hesitant about getting vaccines? I think I'm going to turn to my 2 colleagues who are every day engaged in having these conversations with parents. And Dr. Harley, let me turn to you first, and then we'll ask Dr. Bodie to wrap this up.
Yeah, no, absolutely. So, one of the things that I've always seen is particularly the newer vaccines always raise some concerns just because parents are worried that they're new. I know that's some of the new concern about the RSV vaccine that you had talked about, even in the older adults. is because this is new, and everybody always worries, has it been tested? I know that was one of the big things that I heard a lot of when it came to COVID-19 vaccination, because we had it in the office, we were giving it in the office, and a lot of patients would be hesitant. And it was like, well, it's new. I don't know if I trust it. There's not enough data out there. And then we'd talk about the fact of how it came about, and some was even how it got quickly approved for use. And so a lot of it tends to be that. I think some of the older vaccines, the MMR and polio, I think a lot of it just comes down to they haven't seen anybody with measles or mumps or polio. So they don't understand, like, why am I worrying about this? This isn't something we've seen for years. But, whenever you start to see it, it does raise a lot of concern. And I think, unfortunately, sometimes it takes an example case for people to to get on board with realizing that this is important from that standpoint.
Yeah, I'll just add that I think in general, what I saw is not necessarily a change or an increase in hesitancy on routine pediatric vaccines post-pandemic. So I would agree with Dr. Harley. We saw a lot of mixed feelings about the COVID vaccine and lots of great discussions with families. But what we're seeing across our network is that many of those vaccination rates dropped during the pandemic just for decrease in access or fear of coming to, a medical office when we were having COVID outbreaks. And now I'm happy to say back across our network, we're seeing those same vaccination rates we saw previously with our routine pediatric vaccine. So we're working really hard to get everybody caught back up as they're entering the school year, as Dr. Vanderhoff mentioned, but we are not seeing an increase in hesitancy around those particular vaccines. So it's really been nice to be reconnecting with our families after the pandemic, and again, that trusting relationship and getting them caught up, that really has not been an issue.
Okay, our next question is from Kylie Gessner with WFMJ.
Hi there. My question, so earlier this week, there was a tornado that hit a Pfizer facility in North Carolina, severely damaged it. Are you anticipating any delays or potential shortages in vaccines or other medications as a result of this?
Yeah, that's a very, very good question. And so far, we have not gotten any information that would lead us to anticipate that kind of impact on vaccine availability. Of course, we're keeping a very close eye on that situation. And if that should change, we will not only communicate it, but take every action we can to help mitigate the problem. But so far, we've not had any indication in that direction.
Okay, our final question today is from Bryn Caswell, News 5 Cleveland.
Piggybacking off of that, with the tornado that destroyed the Pfizer plant this week, when it comes to medical device utensil shortages, coming off of the pandemic, what has it taught ODH about preparedness? What have you learned from that?
Yeah, thank you so much. And I think that this is actually one of the bright spots here in Ohio and is reflected in our very high rating by the Trust for America's Health in terms of our public health readiness. It's inevitable in today's world that we are going to be confronting issues that lead to shortages and challenges in the provision of essential health items. Now, that can range from things like protective health equipment to even more serious things like the availability of ventilators due to very, very high demand, an issue that we dealt with during the pandemic. The good news is that the Ohio Department of Health has developed a very robust statewide response capability that includes both the fact that we gather many items for immediate deployment within our ODH warehouse, but beyond that, that we work on a regular and active basis with healthcare providers all across the state, including our hospitals through a very highly developed zone structure that allows us to stay in active and rapid communication with them around issues that may arise, and then to work with them and national authorities to help address or mitigate the challenges as they appear. For example, as you reflect back, you may recall the national problems that arose related to the availability of infant formula. And yet here in Ohio, because of this very highly developed structure we have, we were able to largely mitigate that impact here in our state. And you simply did not hear about some of the absolutely worrisome problems that we were hearing about in some other states. So very good question. And I feel very confident in the preparedness that Ohio now has to deal the best we can with these national and international shortages that arise.
We'd like to thank everyone for joining us today. And Dr. Vanderhoff, do you have any closing remarks?
Well, again, I really appreciate everyone's continued attention to these important issues, especially our focus today on the importance of getting our kids ready for a safe and good school year. And that includes vaccination. So thank you, and we'll look forward to the next conversation.
All right, this concludes today's press conference. Thank you.